Zan Amari, and I am the Deputy Director for IDEAL, and I'm pleased to welcome you to this lightning talk, empowering women and girls through digital inclusion and mobilizing local voices for risk communication and response. Before we begin, I would like to encourage all attendees to introduce themselves in the chat. We would love to know your name and where you're calling from. Please remember to select all panelists and attendees so we can all see. Please note that if you have any questions during the webinar, we would like you to post your questions in the Q&A box, which you can find at the bottom of your screen. Please do not include your questions in the chat box. All questions will be answered during the Q&A session that will be at the end of the presentations. Any questions we don't get to by the end of the webinar will be included in a question and answer document that we will share after the session. You can also upvote the questions in the Q&A box that you would like us to answer by clicking on the thumbs up icon under the question. We'd like everyone to be aware that we're providing French and Spanish interpretation for this session. If you'd like to follow the event in French or Spanish, you will need to click on the small globe at the bottom of your Zoom screen where it says interpretation, and then select French or Spanish. Once you've selected your language, you can choose to mute the original audio, or you can hear it in the background at a lower volume. For English speakers, please select English as your interpretation language and mute the original audio. If you have any technical issues during the session, please send a message to anyone with IDEAL after their name, and we will do our best to assist you. Finally, I'd like to introduce our speakers for this lightning talk. First, we will hear from Ishret Wahid on how Shuhardo 3 adapted digital approaches during the pandemic to promote the digital inclusion of women and girls in Bangladesh. Ishret Binte Wahid is the Senior Team Leader for Knowledge Management and Learning at Care Bangladesh and has a master's degree in Development Studies from the London School of Economics and Political Science. Being a certified qualitative researcher, she chose to pursue her career in knowledge management, learning, and gender. She is passionate about innovative program design and evidence-based program management, and her expertise lies in interpreting quantitative data, layering data, and visual presentation of data. Our second presenter is Amit Smotrich, who will talk about how Sapling used strengthened disaster response infrastructure and digital tools to reach communities with critical messages to respond to COVID. Amit Smotrich supports the USAID-funded Sustainable Agriculture and Production linked to improved nutrition status, resilience, and gender equity, Sapling, activity, implemented by Helen Keller International in Bandarban, Bangladesh. She is currently a Leland International Hunger Fellow. In her capacity, she supports project implementation, collaboration learning and adaptation, CLA, and communications. Amit has worked in international development for over 7 years on a range of issues, including food and nutrition security, environment, resilience, and water and sanitation and hygiene. First, I will hand it over to Ishret.
Thank you. I believe my sound is clear. I would like to express my gratitude to the IDEAL team for this great opportunity. at the very first of all, and then welcome everyone to this presentation. Today, I'll share experience on digital inclusion from Shohardo 3, which stands for Strengthening Household Abilities to Respond to Development Opportunity. This program is funded by USAID and the government of Bangladesh jointly. If you can go to the next slide, please. Thank you. At the very beginning, let us get going with a very optimist spirit of digital inclusion, and particularly for women and girls. And I'm going to tell you the story of Shamima, who is a 20-year-old young mother with 2 children and is a primary graduate herself. So Shamima was married before the age of 18. Just like around 60% girls in the country are married before they hit the age of 18. And now, with the help of a smartphone, Shamima is helping her community to access to critical services, for example, telemedicine services, through the smartphone for herself and her community members. She's also providing information on agriculture and livestock using mobile applications that were pre-installed in her phone. And very interestingly, Shamima, this pandemic and tough time, because she's using her smartphone to show different designs to her customers. And she's also able to reach out to her input sellers using the same smartphone. So this beautiful story that I just told you has a long tail to it. And let me just take you through the key points of that tale. And I would start by introducing the program from which we are sharing experience today. So Shohardo 3 is implemented in 947 villages in the northern side of the Bangladesh. We are in 8 districts, and our reach is about 168 households. We work with the poor and the extremely poor strata of the communities. And the communities that we are talking about are typically very prone to disasters. Every year they experience vulnerabilities relating to disasters. These are often very hard to reach communities, and also the transportation system doesn't work for several months in a year. Next slide, please. Now coming back to the point of digital inclusion and what really pushed us to take adaptations or make changes in program implementation and strategies. So before the COVID-19, the majority of our interventions were actually delivered or done in person by our frontline staff. But soon after the pandemic hit Bangladesh, which was in March 2020, and the government identified the first COVID-19 case, we realized that we cannot go business as usual, and we have to make adjustments in our implementation modality. So we started thinking through and finding out ways through which we can make adaptations and make our interventions still be benefiting our participants. And we did not just rely on our assumptions or intuitions, rather we opted for evidence, and we quickly launched a recurrent monitoring survey comprising of about 5 rounds of data collections to understand what was really happening in the ground and what were these women and girls doing amid this pandemic. So the survey revealed that around 20% of women and girls had access to a phone, and only 15% of them had ownership of a phone. And we don't need to explain further how little is that compared to the need, especially when we cannot reach out to them in person. So we started designing implementations and interventions in a way so that we can reach out to them and still make services and information accessible and available to them. Next slide, please. I am going to talk about 3 major interventions that we particularly designed in order to ensure the digital inclusion of women and girls. And the first one in the row was to ensure telemedicine services, which was affordable and timely for program participants. And we had to adopt 3 major strategies to do that, to strengthen the telemedicine system itself. The first strategy we adopted was to do advocacy, and the initiatives were driven not only at the central level, but also at the local levels. And we pursued both the government and the private sector service providers. The second strategy was to kind of formalize this entire advocacy process. And we pursued the Central Health Bureau to issue a letter to their local offices. So they prioritize the program participants and make sure that they have access to affordable and timely telemedicine services. And lastly, but the most important piece, that it is not sufficient to initiate and introduce a new service, but we will also need to make people aware and be used to accessing the services. So we mobilize the local leaders so they can encourage and raise awareness in their communities and tell people to start accessing services, which happened eventually. Next slide, please. The next big interventions from our side was to launch a social media campaign. Although we launched this campaign on the International Women's Day 2020, the intention originally was not, it was not meant for the COVID-19 pandemic. But as we remember, and as we have learned from that experience, that more and more people started spending time at home due to the lockdown. But at the same time, they also started spending more time on social media platforms, for example, Facebook. So through the campaign, we started promoting contents on men and boys engagement, especially sharing household works, preventing gender-based violence or domestic violence and intimate partner violence. We promoted the hotline numbers that was provided by the government. And we also tried to, promote very positive stories of women survivors and champions from our communities who stood out as real champions. So in one way or another, the pandemic actually helped us to achieve a big scale, and we were able to reach out to around 12 million people in just about a year through this campaign. Next slide, please. The third one that I'm going to talk about was basically a test that we did. But before getting into the detail, my key message here through this slide and through this intervention to the people who's listening to me today is to think about different ways of providing aid. Often when we think about providing aid, we think about cash grants and other forms of support. But we live in an age where the importance of smartphone and devices are more than ever before. So we tested this very small pilot with about 100 women and girls to see how that turns out for us. And I'm going to share some major findings from this experience, findings and learnings, of course. So the intent to hand over smartphones to these 100 women and girls was to basically break the digital barrier. And please remember, we are talking about a country where about 70% of the women and girls, they experience domestic violence from their intimate partners. So we wanted to break the digital barrier for them, but also contribute to strengthen their livelihood by doing so. Next slide, please. It took us about 3 months to finally hand over the phone to these women and girls. And one of the major learning from this process that because of COVID, one of the challenges for us to set a very particular and appropriate eligibility criteria. We were all doing Zoom meetings and interacting remotely. So the criteria that we had set out initially did not turn out to be successful. And when we try to do verification or actually hand over the phone, we soon realized that we haven't selected the right people. So we had to get back. We did a lot of back and forths and faced challenges like people went to the field and came back and were not able to hand over a single smartphone because they didn't find the right person. So we had to review the strategy, considering that we were doing very limited interaction in-person interaction with our frontline staff and community members, and did a lot of course correction in that process. So that took us about 2 months to identify a proper and appropriate eligibility criteria and to identify who would be our target population. And then after that, it took about only 20 days to do the consultations, convince people, communicate our bigger vision with them, and actually hand over the phone. Throughout this entire journey, the most critical part was the community entry meeting, because this entry meeting actually allowed us to get approval from the gatekeepers, from the parents and guardians of these women and girls, and also from the elite members of the communities who could potentially be a barrier in this process. Next slide, please. So we did not just hand over the phone to these participants, but we always kept, following up with them, not only with the participants, but also their family members and the community people on a monthly basis. And I'm going to share some of the key follow-up findings. Next slide, please. Thank you. So if you can see, in the first month of the follow-up, we found out that about 12% of these women and girls were able to earn an income. And all of this was possible because of the pandemic, because more people were staying in the community. The service providers were not able to communicate like before or provide service in person. So they had to take the help of smartphone to communicate to the service provider. And in the process of doing so, they were also able to earn a little bit of money. And also in the second round, we saw around 10% of them were earning an income. You would potentially notice that there is a significant reduction in income from the first round to the second round. We are currently conducting an assessment to actually identify what might have caused that. Next slide, please. So in this slide, what we have actually is how these women and girls or the smartphone recipients use their smartphone apart from earning an income. And you would notice that they have used it to access services that are related to health, agriculture, and gender-based violence. We had pre-installed about 5 mobile applications in the smartphones before handing over those to them. So that came as really handy and useful to us. And then they were able to learn new information and share it with their community people and their family members. These women that we are talking about were barely allowed to speak to strangers before the pandemic, especially when it would be about a service provider, a male service provider visiting their household. They're hardly allowed to speak to them because they are male strangers, and there are so many social norms and restrictions about it. But imagine that they are now able to do it with one click in their smartphone, and they're not only accessing information, but also seeking very critical services from them. So in one way, handing over smartphone to this particular group blurred so many restrictions, sociocultural norms and barriers. And that was possible because we were in the middle of the pandemic. Next slide, please. And as I mentioned earlier, we did not just talk to the participant. It was also equally important for us to continuously check that their family members had no objections and were not becoming a trouble for these women to have ownership and access to their phones. So what they told us is they were okay as long as they saw their wives and their daughters accessing and using the smartphones to access services, help the community members to, about agriculture, health, and other related services. They were also obtaining business-related skills, which their family members were very happy about. They were okay with the fact that they were also, especially the young brides and mothers, were communicating with their families and relatives, which they were not able to do otherwise. Some of them are also, watching shows and entertaining themselves, and it was completely okay with their mother-in-laws and their husbands. And the most critical part here was they were also able to access their mobile banking account, which is something that is very useful for them. Next slide, please. Finally, we also reached out to these elite people, local leaders, religious persons, politically influential persons in the communities, and tried to understand whether they saw a value in handing over smartphone to these women and girls, because they were the ones who would initially come and tell us that you're going to spoil our women and girls by giving them access to smartphone, and we are unsure of what's going to happen. This is going to break so many social norms, and we're not supportive of that. But we ensured that we communicated our vision, and I mentioned about the community entry meeting. So after 2 months of the handover, all we heard from them was that these women and girls were critical agents and champions in their community, because of them and their smartphone, people were now able to access information in the areas that I mentioned on the slide. And then these service providers were no more available like before because of the pandemic. So now that they are also able to access all of these services remotely, which is something really useful for the community people. So they had literally no objections for them to continue using that and ensuring the services and access to information, especially critical information, for example, telemedicine and other health-related and agriculture and livestock-related services to the community people who often don't have it. So this is my last slide, but before closing my presentation, all I want to tell is that I highlighted 3 major interventions, and 3 of them are basically interrelated and connected with each other. Through the first intervention, we tried to strengthen a particular system, and that was the telemedicine service that we tried to strengthen. But then it wasn't enough. We also created a platform where people could come back again and again and mobilize themselves, become a community that is very vocal and active against violence against women. And then finally, we made sure that women and girls have the access to right and appropriate kind of devices, and is not benefiting only themselves, but also the entire community through only one smartphone in their hand. So all of this together comprehensively made our digital inclusion strategy successful and a complete story for us. And I look forward to learning from other people that, by making little adjustments, by taking lessons from this pandemic and changing approaches, for example, changing our attitude and approach regarding aid, making it a smartphone transfer or making little adjustments like this sometimes can turn out to be very effective and useful for all of us. So I look forward to see other projects and organizations replicating our lessons and learning. Thank you.
Great. Thanks, Ishret. Thanks, Ellie, Suzanne, and the whole Ideal team. I hope that you can hear me and that everyone is doing well. As mentioned, my name is Amit Smotrich, and I will be presenting on USAID's sapling activity. Like Suharto, it is a resilience food security activity implemented in Bangladesh. Next slide. Sapling is implemented in the Chittagong Hill Tracts, which is in southeast Bangladesh and borders Myanmar. The TheCHT presents a unique and complex operating environment for such a large multi-sectoral project like ours. Sapling is the first project of its kind and scope to be implemented here. So I want to start by giving some background on the region and our approach to help contextualize our COVID adaptations. As you can see from this photo, the TheCHT is topographically very different from the rest of Bangladesh. The landscape is hilly, and villages are quite far from each other. There's low road coverage between main population centers, and those that do exist are often damaged by flash floods and landslides. In the high hills, roads are narrow with dangerous curves. The region is ethnically diverse and has a history of conflict and social tension. 12 different groups, including Bengalis, live in the region, each with their own language, norms, and traditions. They often don't trust each other or the various levels of authority in the area. TheCHT has a parallel governance structure between national government and traditional institutions. There's a strong military presence with multiple security forces due to its post-conflict status as well. The Rohingya crisis has further exacerbated many of these tensions and placed added stress on the limited services in the region. Bandarban, where sapling is implemented, is one of 3 districts within the hill tracts. Next slide. It is the 3rd poorest district in Bangladesh. And as you can see from some of these statistics, access to services such as schools, markets, and health facilities is much lower compared to the rest of the country. As a result, sapling focuses on building local capacity, strengthening systems, and increasing access to services throughout the project. Our efforts increase social inclusion as well as improve well-being. Sapling covered 1,579 villages at its peak, reaching over 54,000 households. These include some of the region's most vulnerable households, similar to Suharto, such as all poor and extreme poor households, all households with children under 2 or pregnant lactating women, female-headed households as well. We also had activities specifically meant to engage adolescent girls, the elderly, and disabled. Next slide. Like other similar projects, we implement multiple interrelated activities to accomplish our goal of achieving resilient, gender equitable food security. These include homestead food production, income generation, savings and internal lending groups, maternal and child health, WASH, and disaster management. Aside from the main activities, 2 key aspects have both been integral to our programming from the beginning and fundamental to our response during Bangladesh's lockdowns and COVID. First, most of our staff are from Bandarban, and over 75% are from ethnic minorities. This means that they live and work in or close to the communities they're from. They speak the languages and know the customs of the families they support. Second, we focus very specifically on strengthening institutions. We successfully advocated for national level policy changes to include traditional leaders and decision-making bodies, and at the same time built up institutions where they didn't exist or were not functional before, particularly around WASH, disaster management, and market systems. Because we were in our 5th year of implementation in March 2020, these systemic resilience and inclusion efforts have been strengthened significantly before COVID hit. We were able to rely on them during the response. Next slide. Sapling had begun a tiered phase over of activities and handover to local authorities in March, right as COVID forced Bangladesh into nationwide lockdown. The first lockdown lasted 2 months and was followed by localized restrictions, which continued to affect Bandarban throughout July of 2020. Many of the impacts of the lockdown, as you can see here, are similar to those experienced in other parts of the world. But because of the region's history, the increased security presence accentuated the fear and the stress that already existed because of the pandemic. Access to critical services was similarly further restricted. Some communities also implemented their own lockdowns, fencing themselves off and not allowing outsiders to enter. And because many of our participants rely on lands outside of their villages for foraging and cultivation, these restrictions had direct impacts on their food security. Next slide. Sapling responded to the initial COVID outbreak in Bandarban in 3 ways. First, we directed support to 500 public, high-traffic community institutions such as health clinics, markets, immunization centers, and multi-purpose shelters. We distributed soap and bleaching powder, and also repaired water systems and installed hand washing stations, ensuring over 27,000 people could access critical hygiene supplies. Second, we supported the response by coordinating with Bangladesh Red Crescent Society. Prior to COVID, we had trained over 2,000 volunteers on search and rescue, first aid, disaster response, and natural resource management. During COVID, we supported their teams to shift message distribution about the pandemic. Next slide. Sapling staff and Red Crescent volunteers disseminated COVID prevention information in local languages to shop owners and residents, as you could see in this photo and the previous slide. They broadcast stay-at-home announcements and hand-washing reminders over megaphones as they walked through population centers and villages. Red Crescent volunteers even supported the delivery of medicines and food to households that were either too remote or too poor to collect them on their own. They helped disinfect markets, jails, and other high-risk areas as well. And since most of the initial messaging was produced in Bangla, Sapling translated it into key ethnic languages and adapted the messaging to ensure they were culturally understandable, tailoring the information to meet local context and local needs. Next slide, please. Lastly, we went beyond Red Crescent volunteers and partnered with community leaders and our staff to develop over 40 do-it-yourself videos in the major languages spoken in the region to help support dissemination of these important messages. This was especially critical as 82% of participants rely on communication with relatives and 68% on community members for sources of COVID information. As you may have noticed earlier, many don't have access to phones, radio, and TV. So a lot of these approaches were really their main way to get information. Working with trusted, recognizable leaders also helped to encourage the necessary prevention behaviors. In the examples shown here of our Wash With Us series, each video is contextualized to the community and the language. In one, the Chakma Queen demonstrates how to build a tippy tap and wash hands properly with her son. And in the lower left-hand corner, you can see how staff at a village community center, supported by UNICEF, adopted the tippy tap as a result of watching these videos and are now increasing access to hand washing for the kids in these areas as well. The videos also included how-tos on topics such as making masks at home and helped to dispel myths around issues like the continuation of breastfeeding during COVID. The reliance on digital tools, while necessary because of COVID, also highlighted other challenges and forced additional adaptations in our programming. Next slide. Since access to mobile phones and networks varies widely from 26% to 76% depending on where in Bandarban you are, this digital and information divide has become much more pronounced. Even where there is network coverage, not all households have devices, and women and girls, Sapling's primary participants, are often not allowed to use them in those households that do have phones. However, since we didn't have many options at first, we started by focusing on those who we could reach. We scheduled regular calls where we could check in with key individuals and leaders from our activities. As community representatives, they served as key messengers within their communities and then sources of information back to our team about needs. We also made two key program changes. First, we increased staff data packages so that they could download videos from the cloud onto their tablets. With government permission to travel during lockdown and now videos in hand, the field staff could then visit all their assigned communities, not just the ones that they're based in. They would share the videos and facilitate small group discussion sessions on these critical messages. Secondly, we committed to increasing access to technology, primarily smartphones, like in Shuhardo, for those within the project who could most take advantage. We identified the local business advisors as primary recipients, since they are village-level market actors and 98% are women. Because these LBAs are producer representatives and communicate regularly with buyers and transporters, supplying them with smartphones helped increase sales and therefore income for them and their neighbors. Additionally, COVID and the shift to remote work has forced our staff across all levels to work differently and help us learn. At the management level, it encouraged us to utilize digital platforms to increase systemization, communication, and access to materials. We created Facebook Messenger and WhatsApp groups among staff who were either in the same geographic area or working on the same activity. These groups became a great way to share new videos or updated messages widely. They also effectively became localized communities of practice and a space for staff to support and learn from each other in real time with photos and other tools shared to encourage collective problem solving. At the front line level, For delivery, because staff couldn't travel far and fears around COVID were spreading, we shifted to much smaller group size for technical training sessions. This allowed much more tailored support to individual and community needs and helped us focus our technical assistance on working with participants to troubleshoot particular issues as opposed to just delivering education sessions. For example, we were able to help participants overcome supply chain challenges such as around livestock vaccinations, and we were able to help facilitate produce sales from income generation groups much more easily this way. These efforts also really reiterated how critical it is to have staff based in the communities they work. As COVID continues to impact lives and livelihoods in Bandarbahn, second lockdown has started as of April of this year. Sapling continues to apply lessons learned last year to increase support for vulnerable populations, mainstreaming crucial information in a multi-ethnic context. As Sapling phases out through September and over, the resources developed will remain available to the general public through social media and transferred to local stakeholders, including government actors, to use moving forward. We're really appreciative of Ideal and USAID for all the support through what's certainly been a challenging few years, months, as everyone has experienced. And I look forward to taking your questions. Thank you.
Thank you so much to our presenters. Ishret and Amit, you did a wonderful job. We will now move on to the Q&A portion of this session. As a reminder, I would like to encourage all attendees to post your questions in the Q&A box, which you can find at the bottom of your screen. Please do not include your questions in the chat box. Also, as Suzanne noted earlier, any questions we do not get to by the end of the webinar will be included in a question and answer document shared after the session. You can also upvote questions in the Q&A box you would like us to answer by clicking on the thumbs up icon under the question. So to kick us off, I actually have my first question is for Amit. So you touched a bit on this at the very end, but given that the highest number of COVID cases in Bangladesh was recorded in April 2021, how has the work of Sapling helped the people of Bandarbahn during this most recent surge of the pandemic?
Sure, thank you for the question. We've really been concentrating on localized support. So like I said, much of our staff is based in the communities where they work, which is critical, and they can use phone, video, social media to both connect with each other as well as their participants, and can move around in small areas, not as widely as they used to be able to before, and participants can't move the way that they used to before as well. But we're really able to focus on providing direct support in the communities because our staff live there. In addition, I think a big part of it has been, like I mentioned at the end, sort of shifting to much more troubleshooting support than the overall sessions that we were giving really at the beginning of the project. We are sort of coming towards the end of the project, so we have these relationships. We know who the players are, and that really helps us respond now to specific needs. Our staff are trusted members of the community. Our name is trusted within the community. So we're not starting from scratch, this time. And now we do have resources that we had started working on and putting into place since the outbreak started last year. So we're able to utilize those more, to remind people of those, and to continue to rely on the systems that we've built up. Thanks.
Wonderful. Thank you so much. Ishret, I have a question for you, actually. So what advice do you have for partners who are considering implementing a similar digital inclusion program?
Thank you for the question, Eddie. And I would like to mention 2 points. My first point, and this is something I also mentioned during my presentation, is to change our approach in terms of traditional forms of providing aids to community people, we often opt out for either cash or other forms of support. But this pandemic has really taught us that we have to think in different and often very innovative ways. So we just switched to a smartphone, and that worked out like magic for many of these women and girls, not only for us as a program. So that was a great lesson for all of us, which I encourage people to try out and see how this turns out for them. And the second thing is to keep on and continuously strengthen systems. So this is really important because all the development projects and where we work in is time bound. So after a certain period of time, we have to phase out from the community people, but we still want them to be able to access critical services, for example, telemedicine services or health services. So we have to continue working on these systems. And also, in ways that pandemic like this doesn't stop us from reaching out to people, and these people are still able to access services and information when they need to. So these are the two lessons I would particularly share and highlight from our experience. Thank you.
Fantastic. Thank you so much for that. So Amit, I'm gonna direct this back to you. So we have a question regarding saying that technologies are effectively disseminated through community videos. We know that. But will you share with us what percentage of the viewers actually apply that message or technology or management practice in their actual life and livelihood?
Sure. So I'll just start by saying that a lot of the technologies and messages that we've been disseminating are not new messages for our participants, right? We've been promoting hand washing from the beginning of Sapling. We're just applying it now to a little bit of a different context. We've also been talking about things like breastfeeding, complementary feeding for children. And this is really about reiterating how much of these practices should remain in this pandemic setting. So it's hard to say, I think, exactly what percent are specifically attributed to the videos. But for us, the videos were much more a way to get the messaging out as fast as possible and in the languages as much as possible. Generally, the uptake really does depend on the technology, but it's all about reinforcement and continuing to support. So I don't have specific numbers, unfortunately, at this time, but I do think that we've seen strengthened relationships between our frontline staff and our participants because they are working much more one-on-one now or in more localized, responses to ensure that all the issues can be troubleshooted a lot, more easily, as opposed to just giving kind of like blanket information. So unfortunately, I can't give a specific number, but hopefully that helps to answer the question a little bit.
That's great. Thank you so much. So Ishret, I'm going to direct this to you now. So how do you manage the misuse of smartphones, whether it's from the husband or others?
That's actually a great question. And it was also initially one of our primary concerns that in any way, these women didn't have much voice within their household and also in their community. So how do we make sure that they remain the owner and they retain the control over these smartphones? And one of the critical things and something that came in really useful for us was the community entry meeting, where we really detail out and explain the purpose of using the smartphones. And we did not really limit us within that community entry meeting. We went ahead, our frontline staff visited the households, following every health measures, and they did informal consultations with the in-laws, their husbands, their parents, to ensure that we communicated these smartphones has to be owned by these women and girls and only themselves, no one else. And just to formalize the process, we also signed a contract between them and us, the program and the recipients, where we detail out the purposes for which this smartphone can be used. And we also detail out that this cannot be used for any criminal or other purposes. So they signed it off. And that's how we kind of made sure that they had the ultimate ownership ownership and access to these phones. Thank you.
Thank you. So Amit, what percentage of the households in the Saplings area have net connectivity? For example, I mean, this would be a great intervention if women and other marginalized populations have smartphones and connectivity available. But what does that actually look like?
Sure. So it really does depend on where you are. In some places, it can be as low as 25% of participants. In other places, it's as high as 76%. So it's very dependent. But the actual availability of the network doesn't necessarily translate into access to the network. A big issue in many places is rolling blackouts, as I'm sure, and not unknown to other parts of the world. But that means that, you can't charge your phone. So that could impact your connectivity. Additionally, we're moving into the rainy season. And weather has a huge impact on how stable your connection is, or if it exists or not. So there would certainly be times when our field staff would call one day and they'd be able to reach a participant, and call the next day and there'd be no connection, even though nobody's moved, right? It is very tenuous. There's also an issue around how many of our participants have the device itself versus access to a device. So I believe that about 37% of our participants have access to phones. There are some areas that have no coverage at all. There are some areas, like I said, that have much more coverage. But again, because access to the phone doesn't translate into access to data or access to electricity per se, it's hard to really suss out at any time how many people have it. Like I mentioned, our program is really targeted to the most vulnerable, and that includes, on income. And so paying for data top-ups is also often quite a challenge, especially now during COVID when incomes are not regular and, people have to decide what they really need to spend on. Sometimes this is not the main priority.
Thank you for that. Ishret, back to you. Can you talk a little bit more about wise targeting? And how did you end up with the selection of the wrong target group?
That's a great question. So the first 2 rounds of targeting that we did came out as totally inappropriate. And we did not realize it because the people who were setting the eligibility criteria for the targeted population were all based at the central level in the capital. And we were only interacting through Zoom calls most of the time. It was unlike before that we were able to get off on the ground and talk to our frontline staff, also get to the community people and ask for their suggestions, like how this would work for them. So it's basically the pandemic that taught us that we have to find out other ways of to think through, solutions and to respond to challenges and problems. And we told ourselves, this is fine. We have a standard eligibility criteria and we can just get to the ground and start handing over the phone. It was only when we sent out the frontline staff, including some of us who were traveling, we realized that we ended up with the wrong people. And these are not the people we would like to hand over the phones to. So we had to came back and, we had to do consultations with the frontline staff. Some of them were done in person only when we could and we were allowed to travel. Again, following all the health measures and safeties and precautions. And then majority of those were done virtually, but this time we followed a bottom-up approach rather than a top-down one. So it really ensured that now we listened to the community people and the frontline staff and came up with a proper eligibility criteria and an appropriate target population. So we really learned from our experiences, but it was initially challenging because of the pandemic and because we were not allowed to move a lot. Thanks.
Thank you. No, I think that is really interesting and really important lessons learned. So thank you for sharing that. So I have one last question, but I'm going to direct this to both of you. I believe this was originally intended for Ishret, but Amit, after Ishret responds, I would actually be curious to hear your answer as well. And so the idea that, we're talking about digital inclusion for both, and the ability to break the barrier of adoption with limited resistance from family members and the community is really quite impressive. However, Ishret, what is the percentage of the targeted people, women, girls who are educated? This would obviously make uptake and adoption much easier.
Well, the people that we worked with, and especially those who were part of this testing process, as I mentioned, we initially handed over the smartphone to 100 women and girls. They're barely primary graduate. And a large percentage of them are women who were married before the age of 18, as I mentioned during my presentation. But we had to find out ways to, make them used to using a smartphone. So the moment we handed over the smartphone, we also prepared a very easy to understand in Bengali manual for them to read it out, or somebody who's in the family member can read out that language, the very local dialect. But also our frontline staff was given training so they can do hands-on demonstration for them. And it was just within a week, these women and girls showed us that they learned how to use the smartphone. And it's really about how you communicate with them, and just showing them that this is the button you click, this is what you see, this is what you read. And because we pre-installed about 5 Android applications in their phone, and we actually oriented them on how to use it. So from the very first day, they knew that this is the app I need to go to if I want to know about agriculture. This is the app for livestock. This is the app if I want to reach out to a doctor. So they were given that kind of orientation, and they quickly picked that up. And that was really a great lessons for us, that we had a mental barrier in our head that they will not be able to use it. This is smartphone. It takes us months to learn how to properly use a smartphone. But they were magic. They came out as wonder, and very strong agents who taught us that please don't underestimate us. Once we are shown the ways, we know how to navigate these phones. So that's how we ensured it. Thank you.
Oh, thank you so much. Amit, I'm giving you the final word here. So what percentage of targeted people, women and girls, were educated?
Yeah, we also have a very low percent of both our participants and some of our staff even, especially the volunteers, the more volunteer staff as well, are not as familiar with using these technologies. So certainly training was very much important as well. We also, part of the reason why the videos are so helpful is, they're not reading the subtitles necessarily on the video, but they can hear it in their own language and see the demonstrations as well. And with a smartphone, you can access that a lot more. I don't know exactly the percentage on education, but vast majority have less than grade 5 level, and many are illiterate. So use of the phones is also very targeted to intuitive use and showing them where the local language videos are. And again, training in local language and practicing with participants.
Amazing. Thank you so much. With that, I'm going to hand it back over to Suzanne.
Thank you, Ellie, and thank you so much, Ishret and Amit. Before we end today's lightning talk, we would love to hear your feedback. So please take a moment to complete our brief evaluation. Kim has shared that in the chat. You'll be able to access the recording of this session, the PowerPoint slides, and a document that answers all of your questions at a later date. Thank you all for attending. And we encourage you to attend any other sessions for the Food Security COVID-19 Learning event. You can access the agenda in the chat box. And have everyone please have a wonderful day.